point, are 7 months in. She's the Senior Interventions Manager for HPV vaccinations at the American Cancer Society. So again, Anna, we're so excited to have you. I'm not sure everybody is today, but we're going to keep on rolling, maybe with the holiday or, who knows, but we're just going to keep rolling and doing this together. So here we go.
Awesome. Thank you. And who's here is just enough. So let's just get started. So what we're going to talk about today is parent, patient, and community education. That's the topic area. I'm going to take a couple turns here and there, and inspired by Elizabeth and her case presentation, we'll hopefully set her up nicely for the amazingness that she has to share. So the next slide will tell us our objectives. The two main ones are to review kind of this quality improvement framework that we've been living in throughout the last couple of months, and then highlight the parent, patient, and community education component. So kind of getting back to those evidence-based interventions of education and communicating within our care teams and outwardly towards our patients and community. Next slide, please. So we have, you're not hearing everything, Denise? Are other folks able to hear me okay?
We can hear you just fine.
Oh no, okay. All right, Denise, I'll try to talk slightly slower, so maybe if there's a delay, it'll catch up. Okay. So here's a slide that I showed many weeks ago, many months ago. We've seen this hopefully in the STEPS guide. This is a tool from the American Cancer Society. It's a general kind of 4 buckets going from point A to point B of how to kind of set up your team after you've chosen to work on HPV vaccination, make your plan. So this is around our aim statement and our action plan, figure out what's our current state and what future state do we want to do and how do we get there. We engaged and prepared our staff through education, formally and informally, as we continuously learn. And lastly, step 4, this is where we are now, right? So fast forward 7 or 8 months of all this work that we've been doing, we're getting our kids vaccinated. And so we know that this process is not linear, that it ebbs and flows depending on who's in our team, who exits our team, who enters our team, how we modify our plan based on obstacles that we can control and obstacles that we can't control. And of course, always refreshing that education, because we know that HPV is one thing that you're working on among a million other things in the clinic. So I want to be respectful of that and know that a lot of the skills and the framework that we're creating helps you with all things in the system and in the clinic. So let's remind ourselves that we're here in this step 4, but that we revisit the other steps along the way, and that QI is just this continuous process, which can be a little overwhelming, but is also exciting because nothing is ever finite or done. So next slide, please. So we've seen this already. These are the evidence-based interventions we've been talking about along the way. Again, education, provider assessment feedback, standing orders. This is not new information, right? And even some of these EBIs, some of these evidence-based interventions may not even have been new to you. You may have already had provider reminders or standing orders. And part of the QI process for you may have been tweaking it to be a better fit for your system or revisiting protocols that were into place. So if you click along, we know that these things are happening. So if we click to the next slide, I'll just do a little pop-up. It's happening. So we don't have to revisit these. You already know them. And if you don't, you know where to reach us to find more resources. How do we stay motivated, focused, and excited? Knowing that, again, just like quality improvement, none of these evidence-based interventions are created and perfected and will exist forever. So how do we keep revisiting them, keep our staff energized as we change things? Next slide. So we know that multi-level interventions are the most impactful. And here on the right side, we see one that we know you have been doing in your own system. Patient prompts, provider prompts, and tracking data. So how do we look to all of our clientele? How do we look in our own house, right? Our own, in the provider realm, ourselves and our care team, and then being data-driven and evidence-based driven. So knowing that we can measure our success and measuring that success to see how we can move along the way. And some combination of these is where we see the most impact, both in our project here in Maine, nationally, and really across the board. In all of our national partnerships, we see that the most successful projects have in some way addressed data, addressed their patients, and addressed their providers, and of course that system level approach. Next slide, please. So what's one thing that we know is a concrete example of one of those multi-components that is done, is very important, is necessary for any intervention to work, and requires revisiting. So we know that the messaging is a little different depending on who you are in the care team and what your role is. But overarchingly, making sure that folks in your system, within your network, feel comfortable talking about the vaccine if necessary. It's a catch-22 because we want to feel confident and good about the facts around HPV vaccination, but we also want to normalize it, right? We don't ask them to know the intricacies of every single protocol or every single thing we're going to bill in that visit. But because of the situation we find ourselves in around HPV, we still are normalizing it. So making sure that we're highlighting this strong provider recommendation. So if we do one more click, you'll see a pop-up. So there is a concrete deliverable of doing education. So we've done the education session. We invited beyond just the providers, their care team, maybe even the front desk and some other support staff. But have we experienced a culture change yet? Are there new folks in our system that need to have a refresher? Have there been questions that haven't been able to be answered? You know, a new patient is a new question that may not have the most concrete answer that we have in those one-pagers from the CDC or from ACS that are really concise. So knowing that we value provider recommendation, we know it's important for the whole system to know about HPV vaccination, and has everyone fully adopted that? And how do we find out whether or not they have, and what can we do to make sure that it's prioritized moving forward? So next slide. I'm going to zoom out a little bit. So I'm using provider recommendation as a concrete example of this for continuous improvement and revisiting some aspects that you've already put resources into and you don't want to lose the momentum. So if we zoom out a little bit, this is national data that came out in August from the CDC, and this is looking at provider recommendation. So we know this past year, the HPV vaccination rates in both boys and girls increased. Not as much as last year, but we did see that boys increased more than girls this year, but they had a longer way to go. So what we saw is more normalizing between genders, which is one of our goals too. And we found this specifically is talking about provider recommendation. And we saw here, I'm going to read the sentence right below the graph here, is HPV vaccination rates for adolescents whose parents reported receiving a provider recommendation were 28 percentage points higher than those who did not. So we see that there is a positive correlation between an increase in HPV vaccination rates and an increase in provider recommendation. So this further justifies our highlighting of the provider recommendation. It's crucially important. If you go to the next slide, I'm going to zoom back in to you. So this is data that we just saw with Jessica. This is the aggregate of all your practices moving forward, and something I see here is an increase, just like the national rate. So what I see here is that your recommendations are working because we know that you prioritize education. So wanted to make that parallel that you're doing the great work that at a national level is being done, and you're doing it in a state that can make a lot of impact with all the adolescents that you have available to you in your systems. I just wanted to take a moment that it can be very exhausting and it can be very structured when we look at quality improvement of looking at data, making our aim and our action plan, doing gap analysis, maybe a fishbone, process mapping. It can feel very structured and towards an end goal, but knowing that it's okay to take a moment to like celebrate where you're at and realize that what you're doing is working and how can you keep building off of that and not always having to create something brand new and tweaking what you have available to you. So I wanted to applaud you for the resources and investment you've made in recommendations, and it shows that it's working. Next slide. What else is working? We know that in the greatest science, we know it's working if it can be reproduced. So I wanted to show you a few resources available to you if you need to rejuvenate your own business case or spread the good news of the business case of why you're doing what you're doing and why it's working. So I'm going to show you a couple HPV vaccination roundtable resources. This one are a couple summary reports that were debuted this past summer at the HPV vaccination roundtable meeting. Here I took a screenshot of their resources page, but I pulled out two that I think would be specifically interesting for you. You'll have this after, so you can click on them, but you can always also go to hpvvaccinationroundtable.org and look in their resource library for these. These are short and sweet. Most of them are limited to 1 or 2 pages with a couple resources at the end of it to make sure that we're quoting. But one is called Improving Clinical Systems to Increase HPV Vaccination Uptake. The second one is called HPV Vaccination Communication in Clinical Settings, an Evidence Summary. What you'll find as you read these are that there's a lot of things that sound familiar to what you're doing. Some of them might take it a step further and may inspire you. Others may be a way for you to tell your peers what you're doing in a concise way and what your national partners are doing. So here just is an emphasis of you're on the right track, you're doing a lot of things that are mentioned here, and maybe some inspiration for future aspects that you could add to your partnership. Next slide. This is another one from the HPV Vaccination Roundtable. This one's a little bit more specific. So these are called health system showcases. They were debuted at the same time as those evidence-based summaries that were on the previous slide. Here, 3 of them exist, and I'm linking to all 3. These are large integrated delivery systems across the country. They did these short briefs, 5-6 pages, I think, where they talked about their journey doing HPV vaccination improvement work, who their leads were, what their team looked like, some background of where they started, the progress of what they accomplished, and then some concrete examples of evidence-based interventions that they did. I scribbled them on my paper so I could read them out, and these are going to sound very familiar to you. Patient reminders, recommending at every visit, recruiting champions, bundling the vaccine, starting at 9, EMR updates, standing orders, provider education, quarterly dashboards, reviewing data with your system and your sites. So I wanted to share these with you to see if it would be interesting to you to see how someone else's annual journey, or some of these are multi-year. Most of these span multiple states and have thousands and thousands of adolescents. So I thought it might be interesting for you, again, to see a reflection of how your work is also happening in other parts of the country, and to further validate that your best practices and their best practices are being reproduced, potentially in different ways, depending on your system. You have to make it unique to you, but that the concepts themselves are being used everywhere. And so there's always somewhere we can learn more, and there's always somewhere we can maybe teach more. So I want to encourage you to keep telling your story, look at these people's stories to see if you can keep spreading the good word. Next slide. I just have 2 more resource slides and then some food for thought slide, and then we can close and move on to the case presentation. But here's just a reminder that the HPV Vaccination Roundtable exists. They have a resource library, and they have these action guides. This is in the same kind of niche example of that provider education. You may have done an HPV 101, you may have already used these action guides, but just to remember, as you talk to your staff, as you get new staff and old staff leaving and coming in, if you need to do refreshers, it doesn't always have to be a full staff meeting HPV 101, and you could even specifically target certain roles, for example, MA nurses, providers, large system, small system, depending on what's a good fit for you. There's action guides, PowerPoints, infographics, all available to you. And both the evidence-based summaries and those health system spotlights that we just talked about are also on this resource library here. Next slide. Wanted to highlight some of the parent education resources. I heavily focused on provider here because you are the linchpin between the provider and the community understanding, and the provider and the patient understanding. So I think if you, within your medical home, you have this knowledge base that you can then give to your patients and then to their community. So on the CDC and on the ACS website, there's a lot of information and a lot of different ways to share information depending on what patients in your network need and what questions they have. So I don't want to overly go through these, but I think you've seen a lot of them. But if you ever are curious if there's a certain tool that exists, please feel free to reach out to me, and I can try and think through all our 1-pagers and 2-pagers and websites to see what is a good fit for you. So on the last page, what did we talk about today? Today we talked about how we're in that step 4. So, right, step 4 is an arbitrary term for the steps guide, but really we're vaccinating. We've done all this work, we've checked our data, we've shown results, we've met our goals. So how do we communicate progress to our practice? A lot of times we function in a core team, and then we add people into their workflow as appropriate. So here's just a couple ideas as we think about going into our last couple sessions and sustainability and celebration. I wanted to point out a few of these bullets that we'll dive in deeper in future sessions, but just remembering to leverage resources and best practices. So all the stuff we just talked about this morning, all those are available to you. You don't need to start fresh. If you need it to be inspired, if you need it to be validating, if it's useful to you, go ahead and use those and spread the word. Check in about your action plan. So you've seen success. So where can we go from here? Are you planning on moving and continuing this work in 2020? Is it going to have more intensity, less intensity? What will that look like? Share the data, right? So you've seen it, we've all seen it. This is amazing. Make sure that you're taking a moment to share it with your clinic and practices and celebrating that success. Sharing the newsletters. You know, those newsletters come out from your team here. And so feel free to, it's already created, to forward those on if appropriate. Remember things that we learned on the October call around IIS and the new reports that we can do. I know it can seem very busy. It's not been part of your current process or pulling of rates, but take advantage of those things if you happen to have time, and see what new things you can learn from them. And ultimately engage your staff. We have a lot of formal ways to engage in QI, but we can't forget about the informal ones. Just asking, how's it going? What do you need? What's working? What's not working? So that with limited resources that we all have, we're allocating those towards things that we know matter and that we know will keep morale and energy up for this initiative that we feel passionate about. So I wanted to leave you with a couple questions or a couple suggestions on how to keep the momentum going as we look towards the closing of the ECHO, and then just remind you of a couple existing resources that you have available to you. That's all I had. Next slide is just thanking you, and I hope I didn't take too much time, but thanks, Jess, that's it.
No, Anna, that was perfect. Thank you so much. And even with starting a little bit waiting for people to